What are some of your most embarrassing medical stories? One night back in high school I woke up with ungodly stomach pains in the middle of the night. I spent an hour in the bathroom trying to vomit or poop so the pain would go away. Eventually my mother drove them to the hospital and after half an hour in the ER I finally got a room. The nurse came in to do all that pre-doctor stuff and the moment she leaves I'll let rip a giant fart and feel 100% better. We left shortly after that and yes it was awkward. This reminds me of that scene in Louis where Louis C.K.'s sister is pregnant and wakes up one night just screaming. After a lot of effort, Louis manages to get her to the hospital and in front of the doctors that are trying to figure out what happened. Then she rips the mother of all farts and all is well again. Solid episode. At least 2 distinct doctors have put their fingers up my bum. One of them also tried to insert a nasal tube, patiently waited while I vomited the last contents of my stomach out on her, and tried again. I have immense respect for that woman. She kept me from having an unnecessary major surgery and was with me all 2 weeks I spent in the hospital. I should send her some chocolates or something. Maybe white chocolate is more appropriate, all things considered. My father is a nurse. He used to be a nurse. He now works in patient transport, which is a bit less nutty. He once came home from a night shift and said to me, with a straight face, "You know you're trained professional when you manage to keep a straight face while taking a lava lamp out of a woman." I did not stop laughing for a solid minute. My stepmom is a nurse and from some of the stories she's told me there is something of a human indoor plumbing service. I got circumcised at 13. After the bloody mess and smelling cauterized dong skin, the doc pointed to some towels for me to wipe off with and left the room. After I was finished, the doctor, my mom, and I had a brief debrief of the operation, and he boasted and elaborated to my mother how many stitches he had to use because my dong was so large. To be perfectly honest, it's average at best. My mother had the most awkward face I'd ever seen. Your son has what we in the medical community would refer to as a monster dong. I'll leave you with these pamphlets. This pretty young nurse used to hang out in my room in the couple of days before my surgery. She gave me company and I was her escape from rude old men. She always smelled nice. So the surgery was at the end of my spine, or top of my butt basically. IWS a hairy mofo even in high school. So this one time she comes in with breakfast and I'm like hey and she's got dead eyes and a stone face. "Turn around please." I do, and off comes the gown, and she starts shaving my butt for the next hour. It was never the same after that. When I was about 10 I had an abscess in my butt, like right next to my butthole. I went to the doctor's office to get it checked out, and they decided they had to pop it. I'd gotten these things semi-often and I had to operate away some tissue or something. Still haven't butt scar. Anyway the nurse that drew the shortest straw had to pop an abscess inside a 10-year-old butt. It might be that it was kinda big, or that it was under a lot of pressure, but she got sprayed by a pus fountain. From my butt. TL. Doctor sprayed nurse with butt pus. The don't shoot IV drugs into your taint story is worse. So much worse. It's not too embarrassing but I gave birth 2 weeks ago to a baby not made of poop and got an epidural. Apparently those things make it impossible to hold in a fart. Did not know that. My technique was talking loud every time I farted. I became active in my private life when I turned 18. I knew about fricking, where babies came from, etc. thanks to adult ed classes. So my boyfriend at the time and I had protected fricking, condoms and birth control. He was paranoid 99.9% of the time we fricked. Well, we slipped up once, but I thought, no big deal. I'm on birth control anyway. Weeks later, I'm a couple hours away from taking a test for a class and I get these cold sweats. I'm talking extreme. Then I get this ridiculous pain close to where I thought my ovaries were. I felt like I was dying. I googled my symptoms and the first thing to pop up was an ectopic pregnancy. I immediately panicked. I went to my professor, who saw that I was in no state to even come to class. He sent me home. I asked my friend to drive me to the ER. I saw the doctor and told him of my suspicions. He asked me what I had eaten that day and pushed down on certain areas of my stomach. Turns out, the food I ate and the time I ate it gave me gas that got trapped. TL. DR. Thought I was pregnant. Turned out to be a fart. I can't wait for the moment when your child will ask about brothers and sisters. You almost had a brother once. It was a fart though. I had a wart frozen off the inside of my foreskin. By inside I mean, you had to roll it fully down. On the wart was located just underneath the bottom of the head. The most awkward place ever. The only way for the area not to touch any other part of my dong was to hold the skin back. That was impossible, so I settled for using tissue to create a barrier. Discovered that TP will glue itself to the head of your dong and takes a very long time to get off. I had a rash develop on my left armpit when I was 18. It was awful. So bad that it looked like one of those frosty burns which kids used to give to each other with cans of deodorant. I assumed that I was an idiot and had given myself a frosty by using deodorant too vigorously. Eventually got to the doctor and I explained how I had given myself a frosty. He just looked at me for a while before saying, "I don't know what a frosty is, and I don't condone those, but I can tell you that this is impetigo, a rash mainly developed by dirty 2 5-year-olds. All 2 5-year-olds are dirty, sticky hands, snot, bibs, shiver." In a similar vein to OP, I too was once constipated. I was roughly 12-13 at the time and didn't really know about constipation. Every now and then a nugget would pop out and I simply thought that's all the poop I had to do. Until one sunny afternoon, I experienced a bad cramp in my gut, a contraction, if you will. I spoke to my mother, who is a nurse at a hospital, and explained my predicament. We went to our local doctor and he explained that I had a poop backlog and it could really do with being evacuated quite soon. Looking back on it, this did take place over about 9 months. I was checked into another hospital, not the one my mother works at, in a few days and administered suppositories. No effect. I then received an enema. This also had no effect. Over the course of the next 2 days I received another set of suppositories and 2 enemas. Then one night while I was asleep my body let its guard down. I awoke with another contraction and feeling the imminent doom that was about to escape my anus, I headed for the lavatory. As I sat down on the toilet I heard what could only be described as the gates of heck being opened and felt my body literally become about 5 pounds lighter in 3 seconds. My entire lower body went numb. As I tried to move, the small of my back ached. I called for a nurse and after being helped back to bed I overheard the words "waste team" being said. I spent the next 10 hours in a deep sleep, whilst I spent the next day in a wheelchair, before being able to use my legs again. And that toilet was out of use for 3 more days. I think they had to replace it. Man, this is the best thread ever. I have tears rolling down my cheeks at this point. When I was 12 my school district required any kids going out for sports to have a physical. This included the whole "don't drink, don't smoke, let's take your blood pressure, check your vitals, etc." Well, the last and most embarrassing part for a 12-year-old boy is having the doctor examine your groin for hernia. Luckily for me I got a smoking hot female med student to perform my physical. Managed to pop an erection right around the time she asked me to remove my shorts. She tried to act very professional while examining my newly developed manhood before exclaiming, "I'm sorry, but isn't he too young to have an erection?" before bursting out in laughter and leaving the room. Her supervising physician, male, finished the exam while trying to hold back awkward giggles of his own. Meanwhile, my father was wiping back tears of hysteria after witnessing what he was certain to be the most humiliating moment of his son's life. Just for your information OP, some in the medical profession call that the devil's Pez dispenser. Every time they get a little ball of poop out, the next one just pops right up waiting to be fingered out. Shudders. TI. Didn't want to L. I don't know if this counts, but it's funny. So, my dog had a sebaceous cyst on top of his head. He has several lick granulomas. And I thought that this was just another one of those and didn't do anything about it until it got pretty large and started, I'm sorry to use this word, I really am, oozing. So my dog's yearly visit comes around, and we're in the exam room with the veterinarian and the vet tech. I should also mention that at the time, I was 33 weeks pregnant. Normally, I have a cast iron stomach when dealing with medical stuff, but I've also had pretty constant nausea through the whole pregnancy. So the vet tech very enthusiastically pops the cyst while giggling and saying I love these things, and a lot of smelly waxy whitish nasty gunk comes shooting out. Seriously, the gunk came out so forcefully that the vet herself dived for cover. I have pregnancy super nose, and the smell combined with the sight of it was enough to send me lunging for the sink in the exam room. There was dry heaving, which was forceful enough to cause a air expulsion from the other end. So, heave, fart, I'm sorry, heave, fart, I'm so sorry. It was beyond mortifying. Oh god, I never want to be pregnant. Spent 8 hours in a hospital, enduring the laughs of all the nurses and doctors as they made me explain the story of how I hit myself in the eye with a bouncy ball hard enough to warrant being there. Frick you, super bounce. I was 21 at the time. As a precursor, I feel like I have an obligation to let you all know that I have Crohn's. A few months ago, I get home from work and have a feeling of pain in my abdomen. Not uncommon given the disease, so I think nothing of it and continue on with my night. By the time 9 PM hits, I'm curled up in the fetal position with some of the most intense pain I've ever felt. As the night wears on, I eventually vomit and feel an immediate relief. Every few hours though, the pain comes back and I run out of things to throw up. When I saw 6 AM and still had the pain, I knew something wasn't right. Eventually, I'm able to drag myself to the toilet to throw up again, but this one was different. As I later found out in the hospital, I had a bowel obstruction. This one happened to work itself out, by way of traveling out of the system the other way. Yes, I crap out of my mouth. What came out was mostly a liquefied turd. TLDR. Bowel obstruction forced me to crap out of my mouth. I have sickle cell anemia. One of the lesser known side effects, in men anyway, is priapism, a lengthy and incredibly painful erection. When I was 25 I was hospitalized for depression. My first night they prescribed me trazodone, a drug that, in addition to sedation, increases blood flow. Unbeknownst to me, after an hour I had a serious erection. After 2 it was pretty sore. By morning, 8 hours later, I wanted to kill myself. At this point the entire nursing staff was aware of my situation and caught completely unprepared. They have never dealt with anything like this before in the psych ward. They informed the emergency doctor on call and they contacted the urologist on call. A urologist, I might add, that was one of the hottest women I've ever seen. The remedy for this malady is to drain blood from the dong with very large hypodermic needles. I had a burly male nurse holding my hand on one side, who had the most pained, sympathetic and horrified look on his face, an older lady nurse mopping the sweat from my brow on the other side, and this beautiful urologist holding my dong in one hand and sticking a huge needle into my dong with the other. It took almost 2 hours of horror to go away. Awesome. I don't really know much about but when I was little I was also constipated. We were apparently on a holiday. Luckily I don't remember anything from, but the thing is that my mother was so crushed seeing me in pain of poop stuck in my anus. So naturally she went out to wherever you could find a metal spoon, and then she began digging like no other soldier had dug. TLDR. My mother stuck a spoon in my anus when I was little. I read the first part just fine, and lost it at the TLDR. You should use that when meeting new people. About 3 months ago I woke up with extreme pain in my lower back, so me and my father went to the ER. After a while of question asking and discussing in between the doctors they came to the conclusion that I had kidney stones. After a while a male nurse came into the room to give me a pain-killing shot, so I laid down on the operating table and he said, "So, go ahead and pull your pants down." And I was like, why would I pull down my pants? Because this shot has to be inserted in your butt cheek. So as told I pulled down my pants and got mentally prepared since I don't really like shots, neither other males around my bum area. Then, with the most immense strength ever produced by a single man, he literally punches me with a syringe. While that was bad enough, he then proceeds to slap my butt and leaving me and my dad kinda creeped out. Yeah, wasn't good. I'm not sure about this, but the butt slapping afterwards is supposed to make the drug take effect quicker. I had a pilonidal sinus. Essentially I had an ingrown hair at the top of the crack of my ass. Had surgery to cut it open and had an open wound for 4 weeks. They had to unpack and pack the wound every day. Not exactly embarrassing, but I had an extra hole in my ass. After a very long and stressful day, I sat down at my kitchen table as per usual, and out of nowhere felt the worst pain I've ever felt in my right testy. I was sweating and sick to my stomach, so naturally I went into full panic mode, and the only thing that made sense in my panic state was testicular torsion. Not wanting to lose a nut, I demanded that my mother rush me to the ER. I was pacing around the waiting area as my mother checked me in, alternating cold and hot flashes. Thinking that was the end of me, I was admitted to the ER, and this tall, blonde, NPH looking doctor starts inspecting my danger zone. I'm in a crazy amount of pain, and after poking around and asking if it hurts when he pokes this or that, it did. He said I needed an ultrasound done, so they wheeled me out to the ultrasound table, and somewhere between the warm gel and seeing the image of my boys on a screen, something begins to feel strange, an odd sensation, or rather the lack thereof. I was no longer in pain. So I straight faced the ultrasound tech as she finished up and sent me this wait for results. I was fine. TLDR. Nut pain. A false alarm. Well, I don't think you should be embarrassed about that. Acute bad nut pain is something one should always have checked out as soon as possible, and it may have been half twisted and twisted back because of the pressure from the ultrasound. After having a portion of my lung removed, I was resting in the ICU for 2 days after surgery. What I didn't realize is that they take off your underwear during surgery and don't put them back on. I was warm shortly after regaining consciousness, and therefore decided to kick off my blankets. My pork sword was now out for everyone to see, including nurses, parents, other patients and doctors. The ICU ward is open, no private rooms. I had a tube in my chest, so I couldn't sit up on my own, which meant a nurse had to come over and cover up my one-eyed monster, as I had kicked the blankets out of my reach. Oh yeah, this was a children's hospital. I was 17. TLDR. Kicked off blankets, exposed dong to the entire ICU. Upvote for pork sword. I wanted to get on birth control when I was a teenager, and my medical insurance would only cover it if I got my yearly womanly exam, which I had never had before. I did not have a choice of doctor, unfortunately, as I was laying on the table with my feet in the stirrup things. In walks the doctor. Turns out, he was a resident, and he was literally one of the most gorgeous men I had ever seen in my life. As if it is not bad enough having my parts displayed, I was blushing and giggling like a schoolgirl. FML. When I was a teenager. I was blushing and giggling like a schoolgirl. Well, at least the fact that you were a schoolgirl is a plus in this case. In the 6th grade I was playing flag football in gym. This girl had a football, so I went to grab her flag, but because she decided to wear a thong that went up on the muffin tops, I accidentally got my right ring finger around that. She spun to avoid me and my finger got broken in 3 places and dislodged 2 joints. When I told the doctor that I broke my finger on a thong, we had to get him to stop laughing before we could continue. Don't have a lot of time right now, so I'll give the short version. Had to crap after big surgery, on a lot of painkillers, get to toilet, try to sit, fall forwards off toilet while starting to crap, slam my head on the floor whilst laying in my own crap, get hosed off by Jamaican lady. I had a similar situation go down. I was 13 years old at the time, and I wasn't constipated because of diet. I just didn't go to the toilet when I needed to. The urge passed and I got backed up. Had to go to the ER as I had the similar pain. I would vomit anything I tried to eat straight back up. Ended up getting an enema by a hot nurse, while I was blushing trying not to get an erection while she fingered my unholiest of holes. Warm solution goes in, I am helped to a toilet. As soon as butt touches seat, it was like that scene from Dumb and Dumber. I was holding on to the invalid support handle beside the toilet, thinking any second now my stomach's gonna fall out. Moral of the story, when you gotta go, go. My sister is a nurse at the local hospital and she has many tales of insertion removal. Apparently it's very common for people to be admitted with various objets that irretrievably crammed up their pooper. The most harrowing story for me though is of the teenage kid that came in with a PC mouse dangling out of his pee hole. I can't even begin to imagine why, but he'd cut the USB connector off and decided to gingerly thread the entire length of the cord down his wee-wee duct. When he tried to pull it out, he discovered that it had become knotted somewhere down in the depths of his personal tubing and wasn't going to shift. Shiver, the thought of this happening to me just gives me an instant glory hole. My uncle works as a nurse, and for a while was in the ER in DC. One night, he had to remove a doorknob from a man's butt. The only problem was the guy put the doorknob in his butt while it was still attached to a functioning door. The guy was freaking himself with the door and got stuck, and somehow managed to call 911. So this guy shows up and they are attached to a door. My uncle isn't exactly a glowing example of professionalism, and could not contain his laughter as the dude and his door were wheeled in front of him. It all ended up okay. The door finally released him from its clutches, but let this be a warning to you door suckers out there. I had a partially herniated disc, so I needed a steroid shot in my back to get the pain and swelling down so it could slurp back into place while doing PT. Went in, thinking the shot would be administered, in my back. They tell me to pull down my pants. Alright, okay. Apparently the shot gets injected up into my spine from below, so basically into my butt crack. They clean the site with their alcohol swabs or whatever, and load me up onto this machine that has a little x-ray above it. The way they do it, they insert the needle, take a quick picture to make sure it's in the right spot, and then inject the cortisone. Well, somehow, the table breaks. It won't go up and down. The medtechs or whoever keep pressing buttons trying to get the table to move me up toward the x-ray machine, and it won't go anywhere. I'm sitting there, face down, butt up, that's the way, for about 15 minutes. Eventually, they have to call a maintenance dude who comes in and hits the machine a few times, and it starts moving. Great, wonderful. They went ahead with the injection. Hurt like a mother, your spine isn't meant to hold extra fluid. I pull up my drawers, waddle out to my car, go home, and all seems okay. Later that night, I'm wandering around, and my fiancée asks me, what's that on your pants? No idea what she's talking about. Head to the mirror. Apparently, the stuff they used to clean my butt crack injection site was bright blue, and combined with normal guy butt sweat had leaked through my pants to create a big blue stain right on my butt. Checked my actual butt, entirely blue. Took 3 days to scrub it all off. TLDR. Surprise butt crack injection. Got home, looked like I crap a smurf. When I worked in a medical office, I had to transcribe a report about an older gentleman who was experiencing some dribbling from his dong. Rather than seek medical attention for it, he would place a small bean into the opening and just remove it when he needed to pee. Well, one day he couldn't get the bean out. He figured it would come out on its own at some point, so he let it be. Eventually he did seek medical attention because the bean had begun to sprout. It's uncomfortable and cold, but hey, I'm gay so it's like, whatever. As a woman, this reminded me of the time I tried to pretend that a speculum was just an interesting corncob. Not getting anywhere near OP on this one, but I had to get an EKG with a half-shaved chest and stomach cause the batteries in my clippers died. I am a hairy mother, had to explain myself to the nurse and she laughed at me awkwardly. Squat when you poop. I had chronic hemorrhoids and very painful poops, but now since I've been perching squatting on my toilet I've never felt better. I've read that certain digestion diseases react well to this change. Worth a try. It changed my life. This wasn't actually embarrassing for me, because I was so young, probably only around 2. Okay, slight backstory that seems to have nothing to do with anything but will come into play later. Ever since I'd come out of nappies, diapers and into big girl knickers, I absolutely hated them. I'd take them off at any opportunity, at home, on the bus, in the middle of the street, as long as my parents weren't looking. I'd whip those things straight off. So, I'd been constipated for a good long time. I don't recall exactly how long, but enough to cause me quite significant pain and thus my mum some significant second-hand pain having to look after a small screeching backed up ball of poo. She took me to the doctor, at her wit's end, frantically asking him what he could do to help. The doctor looks her in the eye and replies she seems to be doing just fine. Apparently, the look on his face was far from amused. My mother turns around and sees that I have taken a giant baby poo right in the middle of the doctor's floor. I'd taken my knickers off from under my dress before we left the house and she hadn't realized. She still says it's one of the most embarrassing things that has ever happened to her. Yes, I can break out the big one here. 3,653 comments ahead of mine. The first time I had a pee test that I had to take on my own, I guess. I was given a package that contained a large specimen cup and 5 or 6 vials. Being the astute little man that I was, I figured I should fill them all. So, I peed into the specimen cup, shooting urine everywhere, and held my pee while I poured the cup's contents equally into the 6 vials, again splashing pee everywhere. I then resumed my pee and refilled the specimen cup, with more backsplash. At this point, no part of my clothing is on pee. The vials and specimen cup are covered in pee, so I wipe them off, and put them in a paper towel satchel. I clean myself as best as I can, and saunter my pee-soaked self, and 7 containers of pee, back into the exam room. But the doctor simply stared in horror. My mom laughed profusely. I remember, quite specifically, the doctor saying you only had to fill the cup. Sweetie, then why would you give me the vials too? To this day, I maintain I did the logical thing. TLDR. Peed everywhere during pee test. Got laughed at. Not me, but happened to one my buddies, Jamie, while on deployment. We had been in Afghanistan for around 6 to 8 months by this time, and our chow had maintained the same weekly food schedule for our entire time there. After eating the same food for so long, most people, myself including, went through a period where we just didn't eat or simply snacked. Well, Jamie got to this point and decided that all he needed was Cliff Bars, beef jerky, and energy drinks. Fast forward a few weeks later, he hasn't dropped a deuce in a very long while. Me, Doc, our team medic, and a few others are sitting on the porch smoking and joking when Jamie comes up and says, "Yo, Doc, I ain't crap in a while. You got anything for that?" Doc simply shakes his head and takes him into his room to talk to and examine him. Jamie winds up getting taken off the mission rotation for a few days, put on laxatives, and forced to eat the local food, because it'll make you crap. I don't see him much over the next few days until I'm walking back from the motor pool and a group of people run by with Jamie on a stretcher. I stop in my tracks and watch as they run to the helipad, load him on a helicopter, and take off like a rocket. I immediately ran back up to the house and tried to find out what had happened from several people. My boss sat me down and with the straightest face he could manage said, "Jamie's got a real big turd that won't pass, so they're getting him out of here." We both cracked up, and when we saw him a few days later, he looked about 10 pounds lighter. Turns out he had had a similar experience to OP, with the addition of being wheeled into a bomb shelter due to a base attack. To this day we don't let him forget it and still make fun of him every chance we get. TLDR. You're on Reddit, so I know you're not doing anything. If you really want to know, go back and read what I wrote. I'm not paraphrasing anything for you lazy shoots. I went to see my doctor with headaches and dehydration. He asked me some questions and put a camera into my ear. The best bit was the fact that the HD TV he was watching on was in front of me, so I got live footage of what it would be like to dive headfirst inside myself. I just got out a month-long stay in the hospital for spinal fusion surgery and rehab. Had an accident, got a spinal cord injury, now a paraplegic. People don't normally think about this, but I no longer have the sensation of when I need to poop or pee. Yet, as if losing my ability to walk wasn't enough. Anyway, at first, I needed nurses to help me turn in bed. As I finished rolling over, I asked her to put a pillow behind me for support. She replied, "I can't right now. You are having a bowel accident." That's right. Present tense. She stood there, watching me crap myself. She ended up needing to go to a more emergent patient need, and said, "I'll let you finish, and be back." She did come back, but well after 20 minutes and after a nurse's aide walked in on me pooping. Nothing feels more awesome than having people watch my adult, crippled butt pooping. TLDR. I had a nurse watch me involuntarily poop in bed, walk away to let me finish, had another walk in on me doing it. My thought process reading this: originally assumed OP was male, considering content of story. OP has boyfriend. Whoa, OP is female. OP is gay. Why would a gay woman have a boyfriend? Oh, wait, till I'm retarded. During the balls associated with my appendicitis, I had two very good looking ladies help in shoving and injecting stuff in my butt. I give zero fricks considering, but it was weird. The part where you revealed you were gay came as quite the plot twist. I had read it up to that point thinking you were a female. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.